Morning, Mr. Chair and Commissioners. You do have the handouts of our current case information. And the first single page is the Minnesota numbers. So we have almost 52,000, 51,800 positive cases throughout the state of Minnesota. 650 are their newly reported cases. The number of deaths, last week was 1,545, and this week it's 1,576 with 2 new reported cases. And then our Clay County numbers, we have currently 707 positive cases for those newly reported, 39 deaths. We did have that same number for a number of weeks, as you can see on the second page. So. And then no new reported deaths since that last one. So we have, of course, the 970,700 completed tests throughout the state. So they're continuing to do a large number of testing. The hospitalizations on that, on the Minnesota one, is just the Minnesota hospitalizations, the 4,900. We don't have the numbers of hospitalizations for Clay County residents in Sanford or Essentia, which is where the majority of our citizens receive their health care.
Do we keep them separate then when they go over there?
Yeah, we don't get a number from Sanford and Essentia of the Clay County residents that are hospitalized, so we don't have an accurate count, I should say. Okay. We'd have to be checking with them pretty regularly. That's not something they provide for us. And then the age categories, and of course the largest number initially for us was in our long-term care residents. And I know Commissioner Haney asked about our last week you asked about the percentage and why we're a bit high. We did have a large number initially of cases in long-term care and those kinds of settings. And then the numbers are so low, too, to have a good sampling of why our positives are so high. So Minnesota Department of Health, other than just the initial ramp up of cases in long-term care, is the only explanation they really have, because our percentage is a bit higher.
That's what I suspected.
Pardon me?
That's what I suspected.
Oh, yes. In North Dakota, I don't have that list on you on the forms here, but the number of confirmed cases in North Dakota is 5,986. And just because it's, a sister state to us, it's interesting to keep track of what those numbers are looking like. Like in North Dakota, there's 99 deaths. And then in Cass County, there's 2,841 confirmed cases just in Cass County. And 75 deaths. So their numbers are going up a bit as well. So we're just kind of following what the numbers are in Cass County specifically. So as we're working together on that Red River Valley Task Force and sharing information and data. And the second page, the 2-page handout that I gave you just shows kind of from the beginning and just number of confirmed cases, those no longer needing isolation. So the 707 cases, 652 not needing isolation. And so right now 16. And these numbers, if you keep track of what we had last week and the week before, they are ever evolving as Minnesota continues to add the data on those sheets. So they're not an exact number, but they're close to the information as of to date. And the travel, the likely exposures, you're seeing the various ways that there's likely exposure. The reason why the travel outside of Minnesota seems like it may be a bit higher than it has been, they're counting travel into North Dakota as well. So raises that percentage up just a bit. And the age categories for our Clay County cases, it's still the highest number in the 30 to 39 range and 23 to 29. So it's still a fair number of young people, and we anticipate when the campuses, the higher ed students come back, we'll be monitoring that closely and working with them as we may see cases increase with those students coming into our community. Any questions on those?
There's no plan really to check those students as they're coming back, is there?
You know, we've been communicating with Minnesota Department of Health, and they still are standing firm on they will not be testing students that are coming to higher ed. Part of it is the large number of students across the state of Minnesota, and they just don't have the means or the vendors to do that much testing, so they're just not going to. They're instead going to be ensuring that higher ed, if they have symptomatic students, they make sure that they have a place that the students can be for 10 to 14 days, and then following we'll be working with them on the contact tracing of those students and the case investigation. So they're just going to be managing in that way. We don't know yet what may happen with North Dakota and if they will open up a static site for the higher ed. They're still in discussions about that. We still are in conversations with the North Dakota Governor's Office about that, whether they'll open up a static site on the Fargo side and allow some testing from our higher ed on Minnesota side, as they're doing with all their higher ed in North Dakota. So we're still waiting to hear about that. There's not been a confirmation that will happen yet.
Okay, thank you.
Mr. Chair, one question. Kathy, of these 707 confirmed cases in Clay County, we have 652 that no longer need isolation. Do we have any studies that show the number of days from the time that they were confirmed to have it till no longer needing isolation?
Well, the positive cases,
So that would be the confirmed case? That'd be the
Right.
first column.
correct,
Okay.
the confirmed
Yep,
cases.
and then the second column, they no longer need it.
Right.
So what's the time frame from the time they've got listed in the first column till the time they got listed in the second column?
Well,
Is
the
it-
positive cases are 10 days unless they're symptomatic after those 10 days. So they're only staying out for 10 days. And then if they have no symptoms, no fever, and they're well, then they're out of isolation.
So does column number 2, that just means they met a deadline with no symptoms, or have they been tested negative?
No, many of them don't get a second test.
Ah.
Many of them are they have the 10-day period, and unless they're showing symptoms toward that end or still feeling ill, they'll extend that a bit, and the contact tracers will extend their time. Those that are positive, the typical time frame is 10 days, and that's usually what we're seeing. Those that are contacts with a positive case, they're 14 days, because there's an average of 7 to 10 days where they may develop symptoms, so they're expecting them to stay
So
out
there's
a
like
bit
that
longer.
incubation period, or whatever they call it,
Correct.
that they might not show symptoms for 3 or 4 days or something?
Right, correct. Yeah, 3 to 5 days even, so they're wanting them to stay out a bit longer, so it's 10 days for positive cases, 14 days for those that have contact with those positive cases.
Mr. Chair,
Yes.
is there any documentation of prior positive cases testing positive again in Clay County? Have you had any issues with that?
We have not seen any of those in our case investigations and contact tracing. We haven't seen anyone that's come up positive again.
Thank you.
So, any other questions on the data? And
I have
otherwise,
one
I'll
more.
have
We
Jamie
keep-
talk.
Thank you. We keep hearing daily that cases are increasing, but if you do an analysis of the number of tests that are given every day and divide that by the number, if you have the number of positive cases, divide that by the number of tests, the percentage of confirmed cases has actually gone down by half from what it was earlier. It's not going up.
Yeah, and
It's
we
at a
don't-
0.5% or less right now in Minnesota.
In Minnesota, right.
Yes.
And we don't have a real accurate number in Clay County because we're getting negative tests now. It's better represented from Sanford and Essentia, but we aren't always getting those negative tests from the North Dakota Public Health Lab. So it's a little bit skewed, but you're right, in Minnesota it's.
And I made a mistake, I just said 0.5%, it's 0.5 or 0.05, so it's 5%.
5%,
or less,
yes.
yeah,
Yeah, that's right.
of confirmed cases per test.
Right,
Yeah.
right, yep, exactly. That's good, you did that math in your head.
Yeah.
Excellent. That's great. So I'll have Jamie talk just a little bit about, of course, the mask ordinance.
Good morning. Just wanted to highlight a few of the comments from yesterday. The Commissioner of Health and the Director of Infectious Disease from Minnesota spoke with the media, and so that was kind of the masking ordinance. And I'm not going to go into a lot of details in terms of what that is, because there's been a lot of coverage for that, but just wanted to share some of the comments. First of all, the Commissioner of Health really just wanted to encourage people in Minnesota to comply with wearing face coverings and continuing to do the social distancing and try to help curb the spread. A couple of the things that they really highlighted was that they are hoping that people are voluntarily complying, and that their focus is on education and not enforcement. So really stressing the importance. So a few of the things that they pointed out was that they are hoping that people will do this in order to slow down the spread, and they're really expecting that it'll be at least 3 weeks, if not longer, before the data will reflect that there has been an impact, and so to be patient is what their comments are. And then also, she said that within the next few weeks is when it'll be critical that we'll see the response in terms of how it will affect the schools and the openings of the schools. So I just wanted to share those comments from the press conference yesterday with you.
Thank you. Cheryl, you got some?
Cheryl.
Well, I'm going to switch the subject just a little bit. Good morning. We're going to talk a little bit about vaccinations. I'm sure you've all heard on the news that national trends for immunizations, especially for school-age children, those trends have gone downward due to COVID, either clinics being closed or parents fearful of taking their children into the clinic due to COVID. And we just had a call last week with our Minnesota Department of Health. It's a monthly immunization call. And we are going to start offering vaccinations here at Clay County again, probably the first or second week of August. I do need to place an order for additional vaccine, and we are hoping to do maybe a couple of blitz days for school-age children, as we've received a few calls from parents. Everyone hopeful that school is going to be back in session and children are needing their immunizations. So we're going to attempt to do that, and then we will certainly post that information on our Facebook page, on our Clay County Public Health website, as well as doing some public service announcements as exactly when those dates will be in times. If people do have questions, they can certainly call our public health clinic number, and that is 218-299-7777. Thank you.
I'm sure we haven't heard anything from schools yet, whether they not going to allow kids into schools, they don't have the immunization.
I believe the governor is possibly going to make an announcement this week about schools, Thursday. Everyone is planning as if schools will be open in some shape or form, whether that will be all in class or it could be a hybrid of some in-class sessions and some distance learning. So we'll just have to wait and see.
Okay. Very good. Jamie?
Your question about immunizations in school, this is typical that we do immunizations before school and then also for Head Start. So it is a requirement that they have immunizations when they go into school and also for Head Start. So this is pretty typical for us. We just have been holding off on some of those. So we will be opening up and having appointments for people to come in and get those kids immunized.
Yeah, I was just wondering because of some closures of clinics. Of course, I don't know if they're closed or not, but whether they're going to let up on that requirement, but I wouldn't think so. Okay, any other further questions?
In terms of the blitz days, are you talking going into the clinic? In our CARES committee, we talked about like a tent, and doing it outside to kind of help with spread in the building. Is that on your radar?
Well, we're still in the logistics of that.
Right.
Trying to figure that out. Possibly maybe just reserving a couple of our meeting rooms down on the first floor of the Family Service Center, so that people don't have to come all the way into the clinic, and then we would have at least myself and another nurse there to provide those immunizations. So we're still working all those details out.
Just to follow up to that, so on the first floor there, as folks would come in, are we able to, just from a traffic pattern, be able to maintain the social distancing
Yes.
for traffic purposes?
Right, and even if we're doing, like the Blitz days, we would still have people scheduled appointment time, so it wouldn't be just a walk-in thing, because then we start to get people in larger numbers congregating to get in. So by appointment only, then we can space those times out.
Okay.
Any further questions on that?
Thank you.
Okay, that's-
Thank you.
Thank you.
thank you for the update.